living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Pressure injuries, also known as pressure ulcers or bed sores, are wounds that can lead to infection and even death if not treated. Sadly, more than 2.5 million Americans have this preventable condition. If you or a loved one is in a hospital or nursing home or is confined to a bed or chair, you won't want to miss today's show. Welcome to Healthy Living for Life, show dedicated to helping you do just that. I'm Sarah Medley, your host. Stay tuned. Welcome back to Healthy Living for Life. Joining us first this morning is Amy Lundy, a physical therapist from Apple Rehab with an emphasis on wound care. She is here to talk about pressure injuries. Thanks so much for being on our show, Amy.
You're welcome. Good morning.
Good morning. Can you give us an overview of the types of different skin layers and what each does?
Yeah. So our skin is the largest organ in our body, and it plays a vital role in protection and also temperature regulation and sensation. So the outermost layer is the epidermis, and it is basically the outside layer, and it provides protection and a little bit of sensation for us. Next, we have the dermis layer. It is below the epidermis. It has smaller connective tissues, smaller blood vessels, and smaller nerves. And then finally, we have the hypodermis, or the subcutaneous layer, that contains fat cells, connective tissues, tendons, fascia, also the larger blood vessels and larger nerves.
So we're here today to talk about pressure injuries. What is that?
So a pressure injury, often many of us know them as bed sores or pressure ulcers. They are caused by sustained pressure, unrelieving pressure that causes damage to the skin or the underlying tissues. They can cause a lot of damage to our health and reduce our quality of life if we're unable to manage them and get them healed.
Where are the most common areas of pressure injury found on our bodies?
So pressure injuries really can be found anywhere that we have bony prominences, where we have less fat or connective tissue. Common places that we see are usually the tailbone, the buttocks, and usually around our feet, our ankles, our heels. But really it can happen on the back of our heads, our ears, the shoulder blades, between our knees, between the ankles. So any place that there's not a whole lot of connective tissue, we can have a pressure injury quite easily.
Well, what causes them?
So pressure injuries can be between three forces. So you can have pressure, shearing, or friction that is damaging the blood flow to the tissue, not causing a wound. So typically when we have a bony prominence up against a hard surface, such as our tailbone on a firm surface on a bed or in a chair, it can result in a wound.
What are the first signs and symptoms of a pressure injury?
So typically the first signs and symptoms of a pressure injury is going to be some kind of change in the color or the texture of the skin. You can also have swelling, pain. There can also be pus or drainage at the site of a wound, so it's important to check your skin for changes.
What about indirect causes?
So the indirect causes of wounds are things that are going to be like medical condition, such as diabetes, anyone that's had maybe a neurological condition with like a stroke or a spinal cord injury with like spasticity, overactive muscles. We also just have age-related physiological changes where our skin and our blood vessels are more fragile, as well as we have a decrease in fat and muscle mass, and so all of those can lead to pressure injuries. Other things people don't think about for pressure injuries is mental health conditions can significantly increase your risk for pressure injuries, as well as any kind of cardiac or pulmonary medical conditions.
How dangerous can pressure injuries be, and why?
So pressure injuries can be dangerous because they are life-threatening. You can get infections of the skin, which we call cellulitis, or you can even get infections into your bones or joints. And then the obvious major infection is sepsis, and it's a full body infection, and that's, if we don't get these conditions treated, they can cause life-threatening.
I remember reading about ratings of pressure injuries. Can you talk about the ratings?
Yeah, so there is a typical scale of 1 to 5 for your pressure ratings, and as the number gets larger, the more serious they are. So a stage 1 is a pressure injury where you have just a change to the texture or the temperature on top of the skin, and the skin is actually still intact, and there's no damage further down. Stage 2 is a partial thickness skin wound where the dermis is exposed, but down to maybe the fat layers, but you're not going to see tissue damage. You're not going to see muscles or ligaments, tendons, or bones. Stage 3 is more of a full thickness down into exposing some of the deeper tissues of the bones, or not the bones, excuse me, the skin. So you will see fat cells again, but not again down to the muscles or bones. Stage 4 pressure wound is where we have a full thickness loss and you are exposing those tissues, the bone, muscles, ligaments, tendons, and that stage there, really high risk for infections, so it's important to monitor for that. Stage 5 is what we consider unstageable, and it's typically because the wound is covered by a blood-filled blister or a hard layer of skin that we call slough, and it can be black or brown or tan, and basically we can't see the tissues underneath that are being damaged, and that's why it's unstageable.
How about the most common stage? What would that be?
Yeah, I think the most common stage is a stage 2. It makes up about 50% of the pressure injuries, and then that's kind of followed by stage 1. Stage 3 and 4 are a little less common.
Well, in the few seconds we have left, pressure ulcers are common in nursing homes. Is that correct?
So pressure injuries can be common in nursing homes or hospital settings because people are there because they've had some level of immobility or medical conditions that tend to keep them from getting up and healing, moving.
Absolutely.
So, yeah.
Okay. All right. Thanks for that great information, Amy. Up next, we're going to be talking about how to prevent pressure injuries. We'll pause for a short break and be right back to continue this conversation after these messages.